Hello and welcome to Health 247 on Rapid Television, where we keep you informed on important health issues affecting our everyday lives. Today, we take a closer look at a health condition that affects many men but is often rarely talked about openly: erectile dysfunction. I am Josephine Bitrus. Thank you for staying tuned. Erectile dysfunction, commonly known as ED, is a condition many men experience but often hesitate to discuss openly. While many consider it simply a sexual health issue, medical experts say the condition may sometimes point to something more serious, including hypertension or high blood pressure. Studies show that men living with hypertension are significantly more likely to experience erectile dysfunction due to reduced blood flow caused by damaged blood vessels. In today's episode, we examine the relationship between high blood pressure and erectile dysfunction, the warning signs, and why early medical attention matters. Stay with us. Erectile dysfunction, often referred to as ED, is a common condition that affects a man's ability to achieve or maintain an erection suitable for sexual activity. Although occasional difficulties may occur from time to time, persistent erectile dysfunction may signal underlying physical, emotional, or psychological factors that require attention. Several factors can contribute to erectile dysfunction, including stress, anxiety, medical conditions, poor lifestyle habits, or hormonal changes. Despite how common it is, many men remain silent due to embarrassment or fear, delaying the help they need. The good news is that erectile dysfunction is treatable and effective solutions are available. Seeking medical advice early can help identify the cause, improve sexual health, restore confidence, and enhance overall quality of life. Hypertension and erectile dysfunction are closely related because high blood pressure can damage blood vessels and reduce blood flow needed for an erection. Over time, hypertension may cause narrowing and stiffening of arteries, including those supplying the penis, making it harder to achieve or maintain erections.
Relationship between erectile dysfunction and hypertension, I want to look at it from maybe two or three aspects, and one of them will talk about the risk factors when we talk about hypertension. Now, some of the risk factors that are very, very common with hypertension, one of them is obesity, not being able to exercise, more or less like having a sedentary lifestyle, then also not eating the right kind of diet. Okay. And another risk factor is the fact that some of them go undiagnosed with hypertension, and because of that, they do not take the required medication. And some of them who even do might not take it in the way it's supposed to be taken. Now, erectile dysfunction can be as a result of increased blood pressure that is not controlled over a period of time, or it could be that there are some medications that are meant to target the high blood pressure that might also cause dysfunction in erectile dysfunction. So you also want to look at that. Consider that in somebody who is taking antihypertensive medications. Another relationship could also be that of the fact that when somebody presents with erectile dysfunction, it can also give an idea that that person might have some underlying heart condition, okay, that probably had not been diagnosed. So somebody with even increased blood pressure can first and foremost present with erectile dysfunction. The person will tell you that he has difficulty in getting it up, quickly, or it's kind of slow to get up, and so on and so forth. So at that point, we now begin to realize that, okay, maybe there is something wrong that we need further investigation.
High blood pressure affects blood flow by damaging and narrowing blood vessels, making them less flexible and reducing their ability to carry enough blood efficiently. Because erections depend on increased blood flow to the penis, restricted or impaired circulation can make it difficult to achieve or maintain an erection.
Now, in the penis, the male sexual organ, we have what we call blood vessels. We have, although they are smaller, because if you want to compare the size of the blood vessels found in the penis, with the ones found in the heart or some other larger organs of the body, you see that there is a variation in size of the arteries. But we know that for any organ to function in the body, blood must flow through the blood vessels, or must at least reach the blood vessels that actually control these organs. Now, in the case of the penis, if there is a problem with the blood vessels in the heart, because the heart is the major pumping organ of the body, whenever the rest of the body needs blood, it starts from the heart, and then the heart pumps out blood which goes to other parts of the body, the penis inclusive. Now, in that kind of situation, if there is a damage to the blood vessels, maybe due to very increased blood pressure or due to plaque formation from maybe fatty deposits that now attempts to even narrow the blood vessels further, what happens is that blood does not immediately get to the blood vessels in the penis. So as a result of that, it will result in what we call the erectile dysfunction. So there are certain tissues that are found in the penis that needs blood, adequate supply, of blood to be able to make it engorge and stand erect. Now, when that doesn't happen, then it results in a dysfunction. Also, I want to also mention that there are one or two medications, that can also pose as, it might affect erectile dysfunction. Sorry, it might affect erection.
Erectile dysfunction can sometimes be an early warning sign of hypertension or other cardiovascular problems because the blood vessels in the penis are smaller and may show signs of reduced blood flow earlier than larger arteries in other parts of the body. Problems with erections may therefore appear before symptoms of conditions such as heart disease, high blood pressure, or blocked arteries become noticeable, making erectile dysfunction an important reason to consider cardiovascular evaluation.
Erectile dysfunction can be an early warning sign. In fact, if there's anything I would, early warning sign of any cardiovascular, problem that might arise in the body. There are some people who, when they come in, the first thing they might complain about is their erectile dysfunction. Now, there's something that not having an erection does to a man's ego. So that tendency for him to want to say something about it or do something about it, maybe not say something, but do something, might come up. So most times the first complaint that will give us a clue that something is wrong with the blood vessels and also the heart, okay, give us a clue that, okay, maybe there is something wrong with their blood pressure, could be that they came with a complaint of erectile dysfunction. So from there, we will want to now do further investigations to see what really the problem is. Because bear in mind also that there are, other causes of erectile dysfunction in the patient. So we want to rule out those before we are able to rule in the primary cause being hypertension.
Some medications used to treat hypertension can contribute to erectile dysfunction, although not all do.
So there are some medications that, when given to antihypertensive medication, when given to hypertensive patients, might create a side effect of erectile dysfunction. Let me give you two examples of those classes of antihypertensive medications. One of them is the beta blockers. Thankfully, there have been innovations, in pharmaceutical products where the newer classes of beta blockers do not give that kind of side effects of erectile dysfunction. But when we talk about classes like, examples like the propanolol, yes, that could give, you know, cause erectile dysfunction. But for newer classes, especially for those who have hypertension with congestive cardiac failure, now we're talking about medications like carvedilol. Those ones are newer classes of beta blockers, which will not necessarily cause erectile dysfunction. Now, another class of antihypertensive medications that can cause erectile dysfunction as a side effect is the diuretics. You know, when we talk about the thiazide diuretics, when we give this to patients, it will cause erectile dysfunction. Now, one of the ways that happens is that diuretics are actually just meant to reduce the volume of fluid, okay, in the body. So when you give diuretics to a patient, they tend to pee a lot, and that brings down the blood pressure. Now, one downside of that is that because of the depletion or the reduction of volume depletion, there is it causes reduced blood flow to those tissues in the penis that will help to make the penis stand erect, you know, during arousal stage and so on, you know, during sexual intercourse. So yes, that can also pose as a problem. Now, one of the things we do as doctors whenever we want to prescribe medication is to give the classes of medication that will not result in those kind of unsavory side effects. We thankfully, the first line for black people, Afro-Caribbeans, are usually the calcium channel blockers. So those ones are quite safe for people who have hypertension. Another class that is quite good, which can even help to improve blood flow to the sexual organ, is the ACE inhibitors, you know, angiotensin converting enzymes inhibitors. So that one could also help to improve blood flow as well as reduce the blood pressure.
Doctors determine whether erectile dysfunction is caused by hypertension or another underlying condition by taking a detailed medical history, reviewing symptoms and medications, performing a physical examination, and ordering tests when needed.
When it comes to erectile dysfunction, I want to know if the primary cause is uncontrolled hypertension, because that's what we are talking about now. So it's not just about being hypertensive, but is the hypertensive under control? So what we do is I want to take a detailed history of the patient, want to find out, you know, especially when a patient comes in. First of all, when a patient comes in to complain of the fact that they are not able to get their organs to stand up, so we want to check their blood pressure, we want to take a detailed history, we want to know what has been going on in their lives, you know, how have they been feeling over time. So we just want to take a whole history of the patient. We also want to do a physical exam. We'll take the vitals, take the blood pressure. So at that point, it will even mostly usually record very high. So another thing we also ask is that at what point did they notice that they started experiencing that, you know, poor erection or dysfunction? And they will tell you that, okay, they noticed it that, you know, they can just give a rough estimate or a time frame to it, and then we are able to link it to the readings, the blood pressure readings that we get. So another thing we want to do is also to rule out, because low testosterone in some men can reduce their sexual drive or libido, and they might not even get it to stand. So we want to also check for that. So we also do blood tests. Another thing we want to do is a Doppler. Sometimes we want to do an ultrasound. We want to check the quality or amount of blood flow that gets to their sexual organ. So if it's reduced or depleted, then we know that there's a problem somewhere in the major arteries in the body. Then another thing we want to do is take a medication history. Incidentally, when we take the complete history, we also include the medication history. Because bear in mind, I said earlier that we have certain kinds of medication that can also cause antihypertensive medication that can also cause problem with you know, performance, erectile function, and so on. Yes, so we want to also check their medication history. Now, for some other patients, they might also present with diabetes. Diabetes also causes erectile dysfunction, so you also want to look at that What have they been doing? Obesity too is another thing. What have they been doing with their lives? What have they been consuming? Smoking too is another thing. Alcohol is a lot of is another risk factor. So it's taking the comprehensive history that we are able to unravel some of these things.
Controlling blood pressure can improve erectile dysfunction symptoms in some people because better blood pressure control helps protect blood vessels, improve circulation, and reduce further damage to the arteries needed for erections. Lifestyle changes such as exercise, healthy eating, weight management, and stopping smoking can benefit both blood pressure and sexual function.
If we control the blood pressure, definitely to improve, um, it will reduce the dysfunction and even improve erectile, I mean, sexual prowess, erectile function and so on. So another thing is that we want to, first of all, erase the medication that causes that, and switch to another medication that will also improve their blood pressure, control it, as well as improve blood flow to their sexual organs to also help them to maintain an erection. So, very, very much correct to say that controlling the blood pressure can improve erectile dysfunction. Another thing too is to also encourage them to engage in lifestyle modification. So while they are taking medication on the side, they are also engaging in aerobic exercises, brisk walk, running on the treadmill. That helps to improve blood flow to it improves blood circulation, which will also improve the blood flow from the heart to places like the penis of in a man. So that will also improve stop the erectile dysfunction, and then yes, improve in the long run.
For patients experiencing both hypertension and erectile dysfunction, doctors typically recommend lifestyle changes that improve overall blood vessel health.
So I will encourage people who are having hypertension as well as erectile dysfunction to modify their diets. There's something we call the DASH diet, which is called dietary approach to stop hypertension. So you want to cut down on your sugar intake, you want to cut down on fizzy drinks. If you are the type that drinks beer, you want to stop it. You want to also stop smoking, because smoking worsens, it destroys the lining of the blood vessels. Okay, so you want to stop that. Another thing you want to improve is your fruit intake, vegetables intake. You also want to exercise more often to improve blood circulation. You also exercise has been known to reduce blood pressure by between 5 and 10 millimeters of mercury. You see, so blood exercise is very beneficial in blood pressure control. You also want to reduce weight. So if you are maybe on the obese side, you want to engage in weight loss programs or eat properly in order not to gain more weight.
Treatment for patients with both hypertension and erectile dysfunction usually involves a combined approach that addresses cardiovascular health and sexual function at the same time.
So before I will talk about the treatment options, I also want to say something that stress control it's very, very beneficial also in sexual health. So if you are really stressed, you want to increase the amount of hours or number of hours that you sleep. Now, when we talk about medication, for those who are experiencing erectile dysfunction as well as hypertension, so in this situation now, in this scenario, we are saying that, okay, we are implying that whatever is causing the erectile dysfunction is directly related to hypertension. Now, we want to give them the adequate, the right kind of medication for their hypertension, as well as give them the medication that will also deal with the erectile dysfunction. So one of the medications for the erectile dysfunction is what we call the sildenafil. On the market, or in most of the pharmacy stores, we call it the Viagra. So that's a very common medication for them, and it has proven to be very, very effective. So another thing we want to do is also to switch their blood pressure medication. So if they were taking the old school beta blockers, you want to give them the new one, okay, the new set of beta blockers, or you can even change to calcium channel blockers. ACE inhibitors too have been very beneficial in blood circulation and blood pressure control. And another thing we want to do is also definitely lifestyle modification, because whatever medication you take on the side, lifestyle modification is a type of, therapy, not necessarily pharmacotherapy, but a very good therapy in addition to medications that can also help to, control these conditions and bring about a better outcome.
Men who feel embarrassed about discussing erectile dysfunction should remember that it is a very common medical condition and an important indicator of overall health, especially heart and blood vessel health.
For those who are embarrassed to talk about erectile dysfunction with their doctor, I just want you to look at it this way, that whatever affects the sexual health already is affecting the heart, or will affect the heart in the long run. So you do not want to be somebody who will come down with a heart attack. Not many people survive a heart attack. Okay, so looking at it from that angle, you want to be more expressive with your doctor. Now, there's something you need to know about doctors. We've been trained to hear anything, and we don't laugh at you. You can say anything and you can express yourself. There's nothing we have not heard before. So whatever you say is not going to sound weird, it's not going to sound new or even strange. And if you still feel shy about it, you can write it down on a sheet of paper and then present it to maybe the nurse or the doctor and say, okay, this is my condition. And definitely doctors are even happy that you made mention of it, because that will also help them to deal with it very quickly before the condition progresses to a stroke or even a heart failure or heart attack. So we'll encourage people to talk about it. It does not reduce the male ego. Just like every other medical condition can be discussed with a doctor, you're not shy to tell the doctor you're having headache. You're not shy to tell the doctor that you're having a pain in the leg. Please do not be shy to tell the doctor that there's something going on down below, and they will always be happy to attend to you.
So, what important message should the public understand about the link between hypertension and erectile dysfunction?
Whatever affects your sexual health will affect your heart and your blood vessels. So, my final admonition to you will be that you do not allow ego to take over. Please, if there is a situation, or if you notice that there is a slight change in your in how the erection comes about, okay, please feel free to talk about it. Feel free to visit the nearest hospital, because you might even be saving yourself from death or a debilitating condition that stroke might eventually cause. It is very easier for the doctor and even for you to deal with the issue of erectile dysfunction than it is for you to deal with the issue of stroke, because of the effects that stroke attracts is far worse and more dismal than an erectile dysfunction.
In conclusion, erectile dysfunction and hypertension are closely linked through shared effects on blood vessels and circulation, and both conditions can often be managed effectively with proper medical care and healthy lifestyle changes. Open communication with a healthcare provider is key to getting the right diagnosis, treatment, and long term improvement in both cardiovascular and sexual health. Erectile dysfunction can be difficult to talk about, but silence often delays treatment. If you or someone you know is experiencing persistent symptoms, seeking professional medical advice may be the first step towards improvement. Thank you for watching Health 247 on Rapid Television. Tune in next week for more. Until then, eat well, stay healthy, and take care. I am Josephine Beatrice.